Good evening. Concerned but not panicked. That's how Tennessee's health commissioner is describing the dramatic rise in people being hospitalized for COVID-19.
Still, if this trend continues, other experts worry it could even affect people who don't have the virus. News Channel 5 chief investigative reporter Phil Williams recently sounded the alarm about this growing concern. Phil?
Well, for anyone who follows me on Twitter or Facebook, I've been posting the troubling numbers almost daily for the past week. It's a trend that, if we do not take it seriously, could put an even greater strain on our hospitals.
I think we should all be gravely concerned because it affects all of us.
As hospitals continue to deal with the COVID pandemic, the latest warning sign, the number of ICU beds currently available statewide now down to only 216, just 11% of capacity.
We're essentially down to 200 ICU beds for a state with a population of nearly 7 million.
Dr. Aaron Millstone, who treats COVID patients, says the looming crisis even affects people who may not have the virus.
Imagine that if you get really sick with a pneumonia, or if you get a bad case of the flu, or you have a heart attack or a stroke, and you need to go to an ICU, there may simply not be an ICU bed available pretty soon.
This week, one local emergency room doctor tweeted that her hospital has been full this week and forced to divert patients to other facilities, adding Tennessee is in trouble.
And I know firsthand that patients are dying right now in Tennessee, waiting to be transferred from community hospitals to larger tertiary care centers. This is essentially a logjam.
Also related to hospital capacity.
During a morning call with reporters, State Health Commissioner Lisa Piercy said her team is keeping close eye on the hospital numbers. On April 1st, there were 117 COVID patients hospitalized statewide, growing to 295 a month later, then holding steady for the next month. But that number doubled by July 1st, reaching a peak of 1,161 patients by July 29th. The hospitalization numbers dropped for the next 2 months, then they began to skyrocket again, now standing just short of the all-time record with 1,140 patients statewide.
And the average length of stay is 9 days. I want people to internalize that because it's not just a quick in and out. A lot of people have experience with outpatient surgery or with short stays. These are pretty extensive stays.
Tennessee has already set up a large makeshift hospital for non-critical patients in Memphis and a smaller overflow facility in Nashville.
Hospitals need to be coming up with contingency plans, how to convert non-ICU beds to ICU beds. And ultimately, if it really gets bad this flu season, we may have to seriously reconsider opening up the Music City Center for overflow for non-ICU patients.
Now, the other serious concern is that there is usually a spike in COVID deaths coming 2 to 3 weeks after the spike in hospitalizations. But again, we're not powerless. You've heard it before. The governor, the commissioner, and everyone else we talk to agrees we can slow the spread by practicing social distancing and by wearing our masks. Vicki?
All right.